Hi there, my name's Brett Hayes, Tribreath Coach. Today I'm going to share with you a very simple technique using your own body weight to improve the mobility in your elbow and your hand. Some of the injuries we call it bursitis, we may call it carpal syndrome, we may call it RSI, repetitive strain injury. Either way, all of these ailments of the body are caused by one factor, and it's inflammation. So all of the creams, we can use hypericum, we can use helichrysum, we can use wintergreen, we can use all the oils, and there's no doubt it's going to help immensely. But today I'm going to show you a physical technique that you can use on this point of your elbow that will give you instant relief. In this technique, I'm going to show you using your knee and your body, and something that you can do in your own lounge room. As you can see, I'm outside. I just like being outside. But if you wish to, you can do it in front of a television. You can do it sitting on your veranda. You can do it anywhere. Today we're going to focus on just where the tendon, the insertion point of your bicep tendon. Now, a lot of the pain that is felt in the extensor muscles, that's the muscles that come down that give you the ability to grip your hands, they're actually caused by inflammation in and around the joint. So what we're going to do, I'm going to show you how to use your body to improve the blood flow that's going to help your body heal and remove the inflammation. Now, I've got to say, this is hardcore. Now, I'm not saying it's hardcore and for you to be scared from it and run away with oh no, I'm not going to do this. All I'm asking for you is to be very gentle on your body. So when you place the weight on your elbow, breathe. Breathe in through your nose, and remember, you're going to be feeling pain. So pain, just like a good little prisoner trying to get out of jail, let pain out. We're going to be dealing with the insertion point for the bicep muscle. We're also going to be dealing with the extensor muscles down the forehand and the flexor muscles on the inside of the forearm. So we're going to be dealing with that, so to speak, all of that muscle around there. So let's get down to it. Now, for this example, let's pretend we're going to be treating the left arm because it's got the tennis elbow, the bursitis. So the technique, if you're going to be treating the left hand side, I need you to come forward with the left leg and then drop the right knee down. So you're resting your body weight on the right knee. Okay, see that little point just there? That's the bit that's going to be doing the healing work on our knee. So our first job is to move the muscle out of the way. See if I just come through with the elbow and place that elbow onto the arm. See how the bicep stops it? So there's this big gap. So there's a gap, I can get a gap in there. So what we do is we change the force of our direction. We use our knee there and we push the bicep out of the way. See how I'm pushing the bicep out of the way? There it is, out of the way. Can you see that? Yeah, you can see that. And then we fold the arm over. If I was to just come in and bring my elbow in like that, there's no way I can get rid of that gap. So the way we do it is you just use your force to go in that direction. Down. Come from the base of your bicep, lift your bicep up and push your bicep out of the way. So this knee point goes straight into there. So very gently, just bring your right arm forward, just a touch. Big breath in. And on the breath out, take the weight with your right hand and then just lower your knee onto your left elbow. Now do you see how I've just got the knee in the elbow and I'm holding the weight with my right hand, and via that I can use my knee just to go down the arm a little bit. Oh, watch what happens with the fingers. Oh, if I go down, the fingers come in. If I go up, the fingers can go out. If I come down the forearm, the fingers come in, go up. But note the little foot, the left foot. See how I can just, if I bring the left foot back, I can come back and I can change the direction of my weight on the forearm. And there, oh, there's a sore point just there. Ah. So my job is just to sit there and then slowly but surely move the knee down the forearm. And then just sit there on the lump. You'll find lots and lots and lots of lumps. As I say, use your body weight. If it's too much, just bring your body back up. Lift your arm up, your right arm up, and take the weight off the elbow. Coming on down again, lift the knee. Just experiment with yourself, just using your knee into the very joint of the elbow. Oh, there's another sore point, and my fingers are going all tingly. The more you practice, this, the better you'll get at it. Obviously I've been practicing this for about 20 years, since I had massive tennis elbow. I couldn't even lift up a tennis racket. Very gently, and just using your left foot to control your backwards and forwards motion, and just using your knee and using your weight distribution with your right arm to move the knee up and down the forearm. Very simple. And your job is just to sit there 5 minutes, 10 minutes, 20 minutes. I'm just going to come out of the position, take a big breath in and breathe out. And I'm just going to come up. If I can give you any tip, it's got to be being kind and gentle to yourself. Don't try and hurt yourself. Use your weight displacement on your right arm if you're treating the left, or if you're treating the right arm, obviously it's going to be your left hand holding the weight. Just be aware of your weight displacement. So if it's too much pressure, too much weight of the knee coming down onto the elbow, back off, back off. Just find that point of pain, breathe and allow pain to be released from your body. The pressure that you place on the inflammation will bring blood to it. Blood is life. It'll bring oxygen to the injury point. It'll bring oxygen to the inflammation, giving your body that ability to heal. Use your medicinal oils, the helichrysums, the wintergreens. Use your homeopathics, the rust tox. Use your magnesium. Use all of the things you can do, take internally and externally. But just that little bit of pressure. Just remember, move the bicep out of the way and get the knee right into the elbow crease, right onto the insertion point of the bicep tendon. Come down with the hand, breathe in. As you go down, breathe out. Be gentle with yourself, be kind with yourself. Start on 1 minute, start on 2 minutes. When I had tennis elbow personally, I had it in the right arm. I couldn't even hold a tennis racket. I sat there for 10 minutes, 15 minutes. Within 2 days, I was hitting and I was cracking the tennis ball again. It works very, very well on any form of injury to do with the hands. Musicians, carpal, RSI, tennis elbow, bursitis. It works a treat. Be gentle, be kind, breathe plenty in through your nostrils, and I wish you well. Brett Hayes signing out. Hope you enjoy the video.